are you adapting to your environment? Daily, we have constant myriad of stressors, from physical stress, biochemical stress, and mental emotional stress that we're constantly having to deal with. Now, how we're adapting to our environment plays a huge role into how we feel on a daily basis. So symptoms of anxiety, fatigue, and low energy, sleep issues, and even having digestive problems can all be signs and symptoms that we've been stuck in a state of chronic stress too long. Now, what's the big deal with this? Well, our master system, which is our nervous system, we have something called the autonomic nervous system, and tone is everything for every process of how we adapt to our environment. And we have two types of tones that we have. We have sympathetic and parasympathetic. So our sympathetic is our fight or flight system. This is when we basically react to a stressor. This is our survival defense mode. And our parasympathetic tone, this is the tone where we're in more of a calm, relaxed state in our rest and relaxation mode. So basically all day long, our nervous system has to switch back and forth through these two tones for us to adapt to our environment. But the reality is sometimes we get stuck in this survival defense mode, this sympathetic tone, too long. And when this happens, we have a number of things and we just don't feel good and we're not adapting to our environment. So there's a little bit of a trick here I'm going to teach you guys today to help us tap into our nervous system on something that plays a huge role in our autonomic nervous system, and this is called the vagus nerve. This is cranial nerve 10. This nerve has a lot of responsibilities, and for some they say it's the most important nerve in our nervous system. So your vagus nerve affects your inflammatory response, your stress response. It regulates your breathing, your heart rate, and it innervates all our digestive organs. So here's a couple of things. If we're not digesting food well and assimilating, we can't get the energy we need to show up every day. And if we don't have reactivity of our nervous system from this vagus nerve doing its job, we are not going to adapt very well. So today we're going to teach you how to do something called the Vagal Lift. This is a biohack that I teach my patients, where basically we can go in, we can stimulate our vagus nerve to help get our nervous system back into this parasympathetic tone to calm and relax our nervous system down. All right, Parker's going to help us today with basically demonstrating how we do and perform a vagal lift. So the positioning, we're going to lie down on our back in a comfortable position. Our hands will be interlaced behind our neck or the bottom of the base of our skull. And basically what we're going to do here is we're going to have Parker breathe in through his nose and out through his mouth. Very important that we're breathing in through the nose, out through the mouth to get that proper diaphragmatic breath. That also helps stimulate our vagus nerve. And we're going to have him look to his left, out into the periphery. Now when he looks to his left, we're not straining here. You don't need to strain to where it's causing any kind of discomfort, but we're just keeping our eyes out into the left. And we're going to do this for about 30 to 60 seconds. And what we're waiting for, as you see Parker already yawning, is we're waiting for a yawn, a sigh, or a swallow. So now that he's gotten that one already, he's going to bring his eyes to the right side. And again, he's waiting for a yawn, a sigh, or a swallow. Now this can take up to 60 seconds for this to happen. So just maintain that breath in through the nose, out through the mouth, and keep those eyes in your periphery. And there he goes with the right side. So if you notice by looking at Parker's eyes right now, they're glazed over, and this is a good sign of parasympathetic tone activating. And you'll feel a calmness come over your body after you do this. How's that feel, Parker?
Feel great.
And there you go, folks. That's the Vagal Lift.